As employee health and safety, it's a pretty straightforward. They vary by industry and occupation. They vary by occupational or organizational size. Actually, moderate-sized organizations tend to have more injuries. Large ones tend to not have that. Now, that's not true here in Houston because the people that have the most accidents are the oil and gas people, and they're huge organizations to a very large extent. The smaller organizations don't report injuries as well as the larger organizations. A lot of the movement towards OSHA and some of the regulations has been from unions. We talked about unions and said that they were interested in quality of work life issues. Well, injuries and accidents and deaths are part of that. The U.S. is far safer than most other countries, but in healthcare you find a lot of chemical hazards, you find back injuries for lifting, you find repetitive stress injuries, and you find job burnout. And so it is an important issue. Lower back injuries really account for about a quarter of the lost work days. In a lot of industries, noise is a very common occupational disease. You have loss of hearing. I actually have loss of hearing because of earlier things. Food poisoning because of improper food handling is a common illness. Distracted driving is any place where you've got drivers, you've got sleep deprivation and texting and drugs and all kinds of things. So it goes on and on. The most unsafe industry is logging, and so mining's dangerous. There are lots of dangerous occupations out there, and there are dangerous occupations in hospitals. Sleep deprivation is a very large cause of accidents, and you get that with shift work in healthcare. Healthcare's tried to move away from moving nurses all over the place in different shifts, but it still happens. Legal issues, workers' compensation is one, and that's covered in your book. There's a big figure that covers it. It's a federally mandated insurance program, and it's based on liability without fault, and you can read about that. But both public and private are covered. Healthcare is almost exclusively. The policies and provisions vary across states. Not all jobs are covered, so you need to know what workers' compensation is state by state. Premium rates vary. The state basically controls it. Accidental injuries and occupational diseases are covered. Mental and nervous injury due to stress are generally not covered under workers' comp, but a lot of pain and suffering is compensable, so accidents and injuries are covered for the most part. Negligence and willfulness on the part of the employee can reduce the amount of a claim. Workers have to file claims, and they can contest claims. There's attorneys involved very often. Employers start paying typically 21 days after a disability. It's usually not until at least a week. And on the average across the states, compensation is about 2/3 of somebody's salary. There's lots of fraud cases in workers' comp, and there's a discussion about that. Disputes between the employee and the employer are very common, and that's why you get the attorneys involved. The biggest discussion in the textbook is the Occupational Safety and Health Administration Act, OSHA, which was passed in 1970. It created OSHA. It's part of the Department of Labor. Its mission is to prevent injuries and illnesses and deaths in industry. It is tasked with regulating and finding trends, also collecting data. So, and enforcing rules. So OSHA does a lot of stuff. It applies to all U.S. employers. Um, it has a severe violator enforcement program, which is interesting because it addresses employers who repeatedly and willfully violate the law. And here in Texas, many of the oil and gas people are in that program. It encourages states to create safety and health programs, and Texas has done that. It, as I said, it focuses on enforcement, on education and compliance, and it partners and it collects data. It sets limits for exposure to hazardous chemicals, and that has a large effect in healthcare. You can, as an employer, you can request temporary variances to not comply with new standards, or if you're unable to comply. That also affects hospitals a lot. There's a fair amount of record keeping and reporting. Anybody that's got more than 11 employees has to record all injuries and illnesses, and that data has to be kept for 5 years. And the reason that data is collected is because it's used to analyze workplace injuries and ergonomic problems, and what trends are, or what differences there are by industry, etc. There are definitions of what an occupational injury is, and illness, and what gets recorded and when it gets recorded, and how lost work days are calculated. So you should read all of that. There's a section on OSHA inspections. So the OSHA is authorized to enter without delay at any reasonable times. They can inspect and investigate within reason any accidents or any problems that a company has. So they have a pretty open access to your organization. They can report imminent dangers, and if there is a report of an imminent danger or an actual accident by an employee, they can enter your organization. Employee complaints can trigger it. They can target industries. They can do random inspections. So they can do follow-up inspections. They're pretty. They can come into your organization just about any time they want. They can do inspections without advance notice also. All the inspections are conducted by trained inspectors. Then, in fact, there's court cases that have to do with the training and who the inspectors are. There's usually an opening conference, a tour, and a closing conference whenever there's an inspection. You can appeal if they tell you to do something. There's usually an abatement period. They usually give you some time to fix problems. There's a rating on violations. It's other than serious, willful, repeated, and then failure to abate. And so there are different kinds of violations, and the penalties again depend upon whether you falsified information or you violated a posted requirement, or I mean, there's even fines for assaulting compliance officers. So it's bureaucratic, and it's all spelled out. The top 5 OSHA violations really have to do with construction to a very large extent, scaffolding problems, poor communication, fall protection, strapping yourself in, lockout devices on equipment. It's not being able to, I can't think of a good example, but let's say you're running a large press that's stamping metal. You've got to be able to use 2 hands to punch the button to stamp something, so that you can't leave one of your hands in it. That's a lockout device. electrical wiring is almost always a problem, open electrical wiring. So those the big ones are really construction and big industries. The biggest one, the biggest problems in healthcare are burnout with nurses and back injuries and chemical hazards for the most part. Though you do get construction industries in healthcare because they're always building something. Um, they have a lot of OSHA has a lot of services. They'll come in and consult. They'll send people in to tour voluntarily. You can do voluntary protection problems. They have a big safety initiative, and they give awards out to companies, and they will come and train you. So there's a fair amount of assistance that OSHA gives. There's a big long list of employer responsibilities which you should look at. You have a general duty to provide a workplace that's free from hazards, and you have to comply with all their standards, and you have to familiarize yourself with their standards, and you have to continually examine your workplace and remove problems, and you have to provide safe tools, and you have to color code. I mean, the list goes on and on and on. So read it and kind of get the general tone for it, because as a manager in an organization, you're going to have to pay attention to all those things. It's going to be part of it. Automatically becomes part of your job when you become a manager, because OSHA applies to everybody, and particularly healthcare. You have to comply. You have to cooperate with compliance officers, and you can't discriminate employees for exercising their rights under OSHA, wanting safe work, etc. The employee has a fair amount of rights under OSHA also, and they're spelled out in the chapter. You can't discriminate against employees because they want safety features, and they have to have access to the standards, and et cetera, et cetera. The effect of OSHA has been huge. The establishment of formal safety committees, the establishment of very formal rules, and improved equipment, improved medical facilities in most plants, a much greater emphasis on health and safety and reduction of accidents. You don't go into most industries or companies today without hearing about safety or lost time accidents and that sort of thing. The evidence over the years, and we're into 40 years now, is fairly mixed about whether OSHA has reduced accidents and deaths. It depends upon industry. The industries that comply do better, and healthcare for the most part does comply. There has been a fairly significant increase in construction industries, because that's one of the industries that they focused on in the beginning. There has been a reduction in lost work days, and that's major industries. There have been some increases in total injuries. So it's mixed. Bottom line. The rest of the chapter talks about specialized programs to reduce accidents and illnesses. There's a figure that talks about the key principles for reducing accidents, and you really should look at that. That's really important to understand. I mean, safety's got to be internally driven. It's got to be a cultural thing. It can't be externally driven by OSHA. You really have to have culture changes to get people to be safety conscious. One of the things you'll find is that Pareto's law applies to safety just like it applies to everything else, that 20% of the people cause 80% of the injuries. And some people are accident prone. There's a fair amount of evidence of that. But you've got to get a culture of having people not cut corners and ignore safety rules. Excuse me. You really can't count on common sense. You've got to force people to do things. You got to have lockout devices. You got to make people wear hats and gloves and whatever. And healthcare is pretty good about that because there's a lot of dangerous diseases and chemicals. Safety incentive programs work. Um, On-the-job observation and a lot of feedback works. Anyway, read the list because again, as a manager, that's going to be a given for you. You are going to have to be part of the safety and reduction of accidents program and culture in any organization that you become part of. There's a section called selective hiring, which is interesting, and that goes back to the fact that 20% of the people cause 80% of the accidents. You can actually eliminate high-risk applicants. You can predict accident proneness. Older employees are safer than younger ones, and the physical characteristics are related. Poor driving records predict future behavior. Past behavior is the best predictor of future behavior. So if someone's had lots of accidents in the past, they'll probably have them in the future. So the issue is that you can hire people based on accident proneness, and that's an important concept. Safety training works, and there's a section about different kinds of safety training that you should look at. A lot of what OSHA does is issue voluntary training guidelines, and you can do training around those. And training needs to be adjusted to changing workforces too. I mean, again, older people get more training and they tend to be less accident prone, so you really got to focus on new people. And hospitals are pretty good about that. They have pretty significant orientation programs as new people come into the organization. Teamwork tends to also foster fewer accidents. You get higher group cohesion, and workers and teams tend to feel more responsible for each other. A lot of healthcare is teamwork, and so you'll see that. There's usually more than one set of eyes looking at something in healthcare. Healthcare doesn't tend to use incentive systems as much as other organizations, but incentive systems work. There are almost always programs about AIDS and ADA and HIV, and you'll see that in healthcare. Blood-borne pathogen standards are extremely important in healthcare settings, and so you see a pretty extensive programs around that. There's a section about drugs in the workplace, and that can be an issue in healthcare. Healthcare workers are around drugs. Almost all hospitals and clinics today have systems built to prevent drug abuse, PIC systems for nursing with drugs. But drugs in the workplace cost business a significant amount of money. And you'll find that there is a tendency in healthcare for individuals to be drug addicted. One, because they believe that drugs solve illness, so they pop a lot of pills and they get addicted. Others, because you've got relationships between doctors and nurses and other people, and the doctors are willing to give out pills, and everybody has access to the drug. So drug use in healthcare is a problem and probably will remain a problem. Drug users have a much higher incidence of workplace accidents, violence, irritability, just about everything. So a lot of companies do drug testing for that very reason, and you don't see it as much in hospitals as you do in other organizations, but it's becoming much more common because it's allowed. You can do drug testing pre-employment, you can do it randomly, you can do it if there's reasonable cause, you can do it for return to duty, and you can do it post-accident. And so drug testing can be fairly open, and I guess you shouldn't be afraid of doing that, particularly as we probably in the future will open up more and more to allowing marijuana. I don't know if Texas ever will, but but the drug war is being lost to some extent. So you're seeing people just give up and let's stop using our money on stopping the supply and start using it on rehabilitation and training instead to try to keep people off of drugs. Um, anyway, all of that aside, that's not a political statement. That's just kind of the way the country's going right now. It may swing a different direction at a different time. Obviously, unionized employees can bargain about the different procedures that are used in drug testing, but almost all companies have some kind of a drug testing policy, and you should know what that is and what's allowed under the law. Smoking in the workplace is another issue. Now Joint Commission has required smoke-free environments for hospitals, so you've seen the incidence of smoking go down significantly in healthcare, but overall businesses lose billions of dollars, tens of billions of dollars of lost productivity to smokers. Secondhand smoke is a problem. Smokers tend to use benefits significantly more. The increased ventilation required because of smoking is expensive. It goes on and on and on and on. And you get more and more students, or more and more organizations banning smoking both on and off the job. Organizations are giving incentives on health insurance to people who don't smoke, lower rates, or fining people that do smoke. And you can lose your insurance if they catch you smoking, those kinds of things. So you're going to see more and more anti-smoking restrictions and smoker protection laws, and because smoking is simply expensive. There's a section on violence in the workplace and violence protection programs, and that's fairly lengthy. Violence in the workplace is increasing in frequency and severity. You see it every day in the news, not every day, thank God, but often in the news. Homicide is the second leading cause of workplace deaths in companies. So HR is always aware of workplace violence. They typically have policies, they typically have training programs, they typically have security issues. All hospitals have significant security in place, but the consequences are huge from violence in the workplace. Joint Commission has in the last few years come out with extensive programs to reduce abuse of people at the workplace, particularly physicians on nurses, and that's reducing violence to a large extent. So there are a fair amount there's a fair amount of movement towards violence prevention programs in all industries, and healthcare included. Written policies, pre-employment screening, training and education, employee assistance programs, mental health and emotional screening, training managers on how to dismiss employees and how to counsel employees, not really counsel, but coach employees, HR providing counseling for employees. Most organizations have threat management teams, and they have risk management plans in place. Security, police checkups, and security in high-risk areas like ERs, and escape routes, and so it's a fairly large thing that you will deal with as a manager. There are a lot more video surveillance going on in organizations. There's also a section about repetitive strain injuries and video display injuries. You can get eye fatigue and eye problems from looking at computers all the time. You can get muscular and wrist problems from using keyboards and a mouse. And there are new ergonomic keyboards. There's a fair amount of work being done on VDTs, visual displays. There's also a fair amount of work on repetitive stress injuries. That's another huge multi-billion-dollar problem. But the science of designing workspace or work equipment so you don't get repetitive strain injuries is a problem. I mean, even the use of computers in surgery is primarily a little bit for reliability, but it's also because of repetitive strain injuries on surgeons. I think California is the only state that's got safety standards that are related to repetitive stress injuries, but you're probably going to see more and more of that coming down the pike. OSHA is obviously very concerned about it. Occupational stress is another section. There are rising stress levels. You're going to see that in healthcare with all of the stuff that's coming down the pike with payment and the Reform Act. The bottom line is that you're going to see more problems related to stress, either work overload or conflict or job stress in general, causing people to do various things. You see a lot of type A personalities in healthcare, and they usually have more stress problems. So a lot of conflict due to that. And the opposite side of it is burnout. If you get too much stress over time, you usually burn out on the job. And burnout is almost like a depression. And so you can read about that. There are lots of interventions to deal with stress and burnout, and those are discussed in your textbook. Employee assistance programs are also discussed. Almost all organizations have employee assistance programs in HR that deal with emotional problems, that deal with financial counseling, threat problem, just about everything. So, and different kinds of employees have different access to different kinds of employee assistance programs. So understand both employee assistance programs and wellness programs. Hospitals almost always have wellness programs that focus on prevention and non-smoking and stuff like that. The bottom line is this whole chapter is about improving the work environment so you reduce accidents and you reduce deaths and you reduce illnesses due to the work environment. Heavy emphasis on OSHA, heavy emphasis on preventative programs, but that's what this chapter is about, and I've left you a bunch of stuff to read in it, so go do it, and that's the end.